Does Khloe Kardashian have a tumor on her face? Khloe Kardashian recently said that she had a rare tumor removed from her face as a result of rumors regarding a bandage she had been donning. Keeping Up with the Kardashian star, who is 38 years old, posted a series of stories on Instagram in which she explains that she had become aware of various rumors circulating regarding the ever-changing bandage that was being worn on her face, and that some of her followers had inquired as to the reason why she had been donning one for the past few weeks. The reality TV personality admitted that she initially thought a little protrusion on her face was a pimple after discovering it. 7 months after seeing it was not moving, Khloe says, "I decided to get it biopsied." Khloe initially thought the little bump on her face was just an ordinary pimple that was temporary and she hoped it would go away. But after noting it hadn't moved after 7 months, she took a precautionary measure and got it biopsied. She continued by saying that she had been told by 2 separate physicians that the bulge on her face was extremely unusual for someone her age and that she needed urgent surgery. Soon after, Khloe was informed that she needed to have surgery right away to remove a tumor from her face. Khloe then promptly phoned Beverly Hills' greatest surgeon, Dr. Garth Fisher, who's a close family friend of the Kardashians. She knew that he would take excellent care of her face. Dermatologist Dr. Tess Mauricio inspected it, and Dr. Daniel Behruzan performed a second biopsy, since what they both saw was quite unusual for someone Khloe's age. A few days later, she received some unfortunate news. Soon after, Khloe was informed that she needed to have surgery right away to remove a tumor from her face. Khloe then promptly phoned Beverly Hills' greatest surgeon, Dr. Garth Fisher, who's a close family friend of the Kardashians. She knew that he would take excellent care of her face. How's Khloe doing now? She posted a story on Instagram, updating that the bandages on her face were quite visible. She was happy to announce that Dr. Fisher was able to take the tumor out and that all her margins appear clear. She says if it does not come back, then fans will likely be able to see a scar and an indentation on her cheek where the tumor once was. But in the meanwhile, Khloe jokes that she sincerely hopes that fans appreciate how fabulous she made the facial bandages appear. She talked about her experience and urged everyone to perform routine self-examinations and yearly skin checks. She shared how she had melanoma on her back when she was 19 years old, and she had to undergo surgery to remove both of them. Her previous history of melanoma has increased the risk for further melanomas. That's why Khloe urges her fans to constantly monitor themselves. Even those who aren't predisposed to melanomas should self-monitor. Khloe says that absolutely no one is free from these things, even herself, who diligently wears sunscreen every day. She urges people to take this seriously and perform routine self-examinations in addition to their yearly visits. What to know about melanoma? All skin malignancies should be treated, but you should particularly watch out for melanoma. Melanoma rates in the US have been rising quickly over the past 30 years, tripling from 1988 to 2019 and increasing over 50% by 2040. Especially among older populations, rates have been declining in persons aged 30 and younger. Estimates indicate that 7,650 individuals will die from cancer this year, or roughly 20 people per day, and that more than 1 million people in the US are now living with melanoma. Because melanoma is named after the pigment melanin, these skin cancers typically have a dark brown or black color. However, they can also be pink or red. They may resemble a brand new mole or make an already existing one bleed, grow, or alter. Mauricio advises keeping in mind the ABCs of melanoma when performing your examinations. A stands for asymmetry, which means that if you draw a line through the center of your worrisome mole or lesion, neither side will match. B stands for a border. A new mark's borders have ragged or ill-defined edges. C is the color equivalent. From one location to the next, spots have different or new colors. D represents diameter. Although spots smaller than a pencil eraser can be melanoma, lesions larger than that are a cause for alarm. E stands for evolution. Spots vary usually in size, color, or form, or they don't match the surrounding spots. What to do if you find a suspicious spot on your skin. Make an appointment with a dermatologist straight away if a spot, lesion, patch, or mark on your skin, new or old, seems worrisome. Waiting to see a dermatologist, for instance, increases your chance of melanoma spreading to your lymph nodes and internal organs. But occasionally, it's worthwhile to watch to see if a particular lesion or area disappears on its own. It often takes less severe skin disorders like acne 2 or 4 weeks to go away on their own, so Mauricio advises waiting no longer than that. A dermatologist can determine if a skin problem that is not improving on its own or with other therapies is skin cancer. Skin cancers might resemble ingrown hairs, areas of dry skin, freckles, or other skin problems including rosacea, eczema, and dermatitis. You should have your lesions evaluated if it remains the same or worsens within that time.